Hello everyone, we deal with important patient documents and data at our office, and we are responsible to ensure that the data is accurately added or updated in EHR. Let's look at how an error in date of service, that is DOS, while filing, or abstracting, or updating care guideline can affect patients. Say, for example, an external provider who is the primary care physician, also known as PCP, for patient X, has sent a referral to our provider, Dr. J. Meanwhile, we at our office, when receive the document, first identify it as an incoming referral and maintain a log of incoming unsigned referrals followed by filing. However, this referral order did not have clinical records attached. So Dr. J requested a record release of the patient's PMR from the PCP. PCP releases PMR after the patient's consent. Mr. Y from our office received this document and identified it correctly as a PMR. However, while filing PMR, he entered an incorrect year in DOS. We all know that documents are archived in a chronological order as per DOS in the category section. Hence, this document descends to the bottom in the category section in EHR. Becoming difficult to locate the records in EHR, Dr. J could not find this PMR and missed out on the patient's vital information such as HPI, medical history, surgical history, or procedural history, social history, etc. He now has to reevaluate or re-diagnose patient X and maybe even reorder labs or tests. For example, Dr. J couldn't find patient X's previous mammogram and biopsy reports, which had abnormal findings. It followed the same incorrect DOS while filing in abstraction template. Then the care guideline updates accordingly with incorrect interval. Let's look at the overall impact of incorrect DOS. Incorrect time intervals for tests. Patient exposed to unnecessary radiations. Our provider now has to bear the cost of investigations against denied insurance coverage since same test is done in a small interval. Increased in workflow, which impacts production and revenue. More the DOS errors. More is the loss of revenue. A misscheduled appointment can also be the result of incorrect date of service. All of these could lead to a delay in the patient's treatment, which could be fatal. By the time Dr. J came to his final diagnosis, the patient has reached BIRAD 6 and died. Now that we know the role and importance of date of service when we file, abstract and update care guideline, let us find out how we can avoid them. Click the red button to know the first precaution.